Well, the number of patients hospitalized for COVID-19 in Massachusetts drops below 500 for the first time since October.
Here to answer your questions is Dr. Jerome Lee, Medical Director of the Intensive Care Unit at Mass General Hospital. Dr. Lee, thank you so much for joining us. The state numbers are following a national trend here. Hospitalizations, new cases, deaths, all at their lowest point in months now. Are you seeing fewer patients in the ICU, and do you credit that to the vaccines?
Yes, this is amazing news. I'll say that we're all celebrating this news, of course. We are seeing less hospitalizations and also admissions to the ICU for COVID. I do believe that in large part, this is because of the vaccines. We have over 2.8 million adults already vaccinated in Massachusetts. That represents over 50% of our adult population in Massachusetts. And we know that vaccines work well. They're safe, and they also reduce the chance of getting to severe disease if you do get COVID after being vaccinated. However, beyond vaccines, I also will say that we've learned a lot about the disease itself over the last year. We've learned what works and what does not work. For example, we've learned that patients who are hospitalized who need oxygen, if we start steroids early, that reduces the chance of needing a mechanical ventilator, as well as needing us in the ICU, and overall reduces mortality and saves lives. But despite all this good news, though, I will say that we still continue to see a constant, steady trickle of ICU admissions with COVID. So COVID is still here. We're close to the finish line, but we're not there yet.
Exactly. The CDC now predicts an even sharper decline in July. So in your opinion, what's the bigger threat to our recovery right now? Is it the new variants, or is it all that false information about vaccines on social media?
Yeah, this is also great news. If the CDC predictions are true, I believe that we'll be back to something semi-normal by summer or fall, which is amazing. However, this does continue to require us all to get vaccinated, as well as to continue to reduce the spread of virus through doing good public health measures, such as socially distancing and masking during high-risk activities. I do believe both the new variants and also the false information about vaccines will make it difficult to get us to this return to normal that we all want. A good percentage of our population remains at risk. For both of these problems, though, I believe that they're both surmountable, though. As a community, we have to understand that we all want to return to normal. So first, to address the risk of variants, we have to continue to vaccinate. Preliminary good data shows that our current vaccines work well against these variants, especially all the high-risk ones that we hear about. Next, we definitely have to continue reducing the spread so that we don't produce new variants that could be worse than the current ones. In terms of the false information about vaccines, I think all of us have to continue the good fight of putting out scientifically sound and correct messages about both COVID illness and also vaccinations.
I also want to ask you about a new study this week from your colleagues at MGH. They say they've identified a protein signature linked to severe disease and even death in COVID patients. Why is that important, and could it change treatment for COVID patients?
Yeah, this is very exciting research. The first author is Dr. Michael Philbin, one of my colleagues that I work with closely in the ED at Mass General. For the study, Dr. Philbin and his co-researchers looked at 1,500 proteins in the blood. And what they found was about 250 of them were associated with severe COVID disease, or in other words, a protein-based fingerprint of what severe COVID disease looks like in a patient. And a lot of these proteins, of the 250, were proteins that interacted with the immune system, possibly even activated it. So overall, this sort of shows us why steroids potentially stop the progression to severe disease. What is exciting about this research is that it sort of gives us new targets for novel drug therapies in the future for COVID.
Okay, Dr. Jerome Lee, Medical Director of the Intensive Care Unit at MGH. All very exciting, all that progress. Thank you for joining us.